Good evening, fellow Toastmasters and most welcome guest. I want to begin my speech by asking you how many of you know someone with diabetes or have diabetes? Wow, that's a lot of people. Well, as Latinos, we all run a very high risk of developing just diabetes, especially type 2 diabetes, because we tend to have pretty unhealthy lifestyles. We eat fatty foods and don't exercise very much. And therefore, I am here to also talk to you about the importance of creating action around diabetes cause, to talk to you, especially as professionals who are leaders in your careers. As leaders in your careers, you have the most instrumental tool. You have a voice and you're strong advocates, and your communities and neighborhoods are going to listen to you. So don't think that because you're not in public health, you're not a public health professional. This doesn't have anything to do with you. So therefore, I want you to acknowledge that it is a very important cause and that I am here to encourage you to participate in the Step Out to Fight Diabetes Walk that's going to be coming up in October of this year. So let me begin by describing a little bit what diabetes is. Diabetes is either a shortage or a decreased amount, or you just don't have insulin that will transform, that will take. The insulin is the thing that transports sugar into your cells, that transforms it into energy. And when there's too much sugar in your blood system, that can really affect your body. It can affect your heart, it can affect your eyesight, your kidneys. If you're pregnant, you can have pregnancy complications. And if you don't take care of it, if you don't attack it and continue to take care of it for the rest of your life, it can lead to death and even limb amputations. So this is a very serious cause, and I encourage you to all, help me fight this. There are two types of diabetes also that you need to be aware of. There's type 1 and there's type 2. Type 1 is usually the type of diabetes that you develop when you're a child or an adolescent, and type 2 is better known as adult onset diabetes. However, since last year, 79% of the children that were diagnosed with diabetes were only between the ages of 10 to 19. So this is not just a problem that we need to take care of in adults, but also in children. Now let me give you some more powerful statistics. In our U.S. population, 20.8 million adults have diabetes. That's 7% of our population. Of those 20.8, almost 7 million children and adults don't even know they have diabetes. This is a ticking bomb. 1 in 10 adults right here, right now, have diabetes. And for the women here, 1 in every 2 Latinas have diabetes. As Latinos, we run the risk of 1.7 times more likely to develop diabetes. An estimated 54 million people are pre-diabetic, which means that their sugar levels are pretty high, but they're not high enough to be classified as diabetes. And if they don't take care of their health, they're going to lead in that same path, and some of the consequences that I've just described are going to occur. As a consequence, 80 million people in the past year had limb amputation. That means that they had to cut off either a toe, a foot, because diabetes affected this part of their bodies. As Latinos, I'm sorry, there is a dire need to undertake diabetes in a public health awareness campaign. One reason Latinos have higher risk of developing diabetes, like I said earlier, is because we don't have healthy diets. We're too into our tamales, we're too into our chiles rellenos, we're too into our refried beans and our taquitos. And education is imperative. It's imperative to educate these families in these neighborhoods that it is important to either have some type of food moderation, eat some of these unhealthy meals in moderation or proportionately, and we have to do exercise. This is type 2 is one of those easy things that you can prevent by keeping a healthy diet and doing exercise. At least 60 minutes. 60 minutes is not a lot of time. I've done it. I've incorporated it into my lifestyle. I've encouraged my mom to do it, and it goes by like a breeze. So if I said, like I've said, we have to pay close attention to this. Children also have a very, very, like I've said, strong chance of, especially now, a big chance of developing diabetes. 32% of our children in our schools today are overweight and 72 are unfit. So for those who are parents, I just want to let you know that when you give them those $5 at the beginning of the week, make sure how they're spending their money, especially if they're used to spending it on snacks. A lot of the snacks that they eat after school probably have a higher caloric content and fat content than the meal that they're supposed to eat with you at dinner. Now, as Latinos, we need to be proactive advocates of public health education and prevention. So what is this whole Step Out to Fight Diabetes thing, like I mentioned earlier? Well, this is the walk that the American Diabetic Association is organizing here in Long Beach in October on the 20th. And it is to create awareness to this devastating disease. The way that you can participate and Step Out to Fight Diabetes is by either a company sponsorship. So I know a lot of you are business owners, and there's that marketing cost that you can participate in. And for those who are not as ambitious in participating in the program or in the walk, you can either register as a walker and have a fundraising goal starting of $150. And most individuals will give you some type of money. And it's only really a $15 donation, minimum of a $15 donation. Or you can be a little bit more outgoing and organize a group of friends, a minimum of 5 people, and go out and participate in the walk on that Saturday morning. It's so these funds will go directly to research, advocacy, and education. And I think I'm doing education and advocacy right now. I also do some research back at the hospital. So I think it all has a very great purpose. So just to let you know, it takes really a village to make a change. And I'm here to create some type of change in our public health system. It's one person at a time. Here I have about, I'd say, 30 people. I hope I can reach at least 2/3 of those people to help me raise some money for Step Out to Fight Diabetes. So I encourage you to cogitate about registering to Step Out to Fight, and I will be sending you an email in the near future explaining to you how to become a part of this walk.